Good morning. So I'm gonna perform an easy PAP. So first and foremost, make sure we check the patient's chart for any information that we need to obtain. Once inside, we always make sure we introduce ourselves, let the patient know what the therapy is, such as good morning, my name is Anthony, I'm from the respiratory care department. So the physician ordered you an easy PAP. This one is help you relieve any secretions present, clear up your airways, and also help mobilize secretions and prevent your lungs from totally collapse. So before proceeding with the therapy, make sure we assess the patient, make sure we obtain any information and vital signs, position the patient if they can sit upright, if not we can adjust the bed, and then make sure we check also the ID band if the patient is the correct patient and for confirmatory purposes. So after that, we wash our hands. After washing our hands, we make sure we can wear appropriate PPE such as gloves, and we can start with demonstrating it to the patient. So this one is, it has two ports on it, and then before inserting these ports, make sure we inspect this one for any cracks. So this port in here is where we're gonna insert the pressure monitoring port. Make sure that these two ports that you're gonna insert it should be tightened and secured. The other one is for the oxygen tubing. So with the oxygen tubing, we're gonna hook it up in this flow meter, and then initially we start it up about 5 liters per minute, and then we should not exceed the inspiratory flow of patients at 60 liters. We should avoid that one. And then when holding it, the patient should hold it upright like this, should not be downward, and then they should not occlude on the back. So ideally, we start the patient to take a slow deep inspiration, and then after that, let the patient take a strong exhalation but not in a forceful way. So when taking up a strong exhalation, we can let the patient at least take about 3 to 4 seconds, and then after that we can also let the patient rest for a few seconds and proceed another attempt. So we can use this one also using a mouthpiece, which is common, and then if the patient could not tolerate using the mouthpiece, we can also use it with a mask, where we should have an option to it, so that that way if the patient could not tolerate,
I'm sorry, I just need to check this.
we can also use it with a mask. So if we don't use this pressure monitoring port, we should remove this one, dispose, because it is a disposable one, and then we can also use it without a pressure monitoring port, wherein we should close this one to prevent this port from exposure to ambient air. When doing this one also, by the way, they should not occlude on the back. And then also important thing is, with this we can also use it together with a nebulization treatment, where there's a T adapter with its medication cap, and it would help optimize and improve their lung volumes. So once everything is done, make sure this one is removed, put it back in a safety bag, and then this one should not be soaked or washed, should be air dried, except for the mouthpiece, wherein they can clean it with sterile water and air dry. And then reassess the patient, and also let the patient cough, observe for any amount, consistency, and color, and then assess the patient, re-auscultate them, and then once you go outside, of course, wash your hands, and then take note and chart whatever the initial pressure the patient was able to reach and communicate with the staff.